record. Good morning or good afternoon on your end, Mina. How you doing today?
I'm good. How are you?
I'm good. I'm good. I really appreciate you taking a little bit of time out of your day to talk to us a little bit. So kind of cutting right to the chase. We first met almost a year ago, a little less, maybe 9 months or so ago. But tell me about your kind of headache journey. Your symptoms began somewhere around 2015, if I remember correctly.
Yes. So I ended up getting diagnosed with occipital neuralgia in 2015, but I had been having symptoms for a couple years prior to that too. Everything kind of came on in terms of the migraine pain and what I now know as occipital neuralgia in early high school. So that's when I really started to have issues with it, thinking it was, just regular migraines, which then progressed into pretty much my senior year of high school. Every single day, I couldn't make it through the day.
Oh,
I would have to go home or have somebody come pick me up because I was in that much pain that I couldn't even drive myself. So
hmm.
it over the years I've gone through phases of having no flare-ups for a couple months, and then I'll have flare-ups almost every single day. So that's been the pattern essentially. But I had seen a lot of doctors. I even saw a specialist at Georgetown when I was in high school who didn't even catch the occipital neuralgia, which is crazy. But I ended up trying pretty much every medication you can imagine to try and help with all the pain I was suffering from. And I eventually just went off of everything, tried all sorts of things like chiropractic care, acupuncture, you name it. I've tried it since then. And most recently, before I ended up coming to you, I ended up trying Botox. So I was determined to get this figured out. And essentially, the trigger for all of this happening when I found out and I was diagnosed was when I went to the hospital for the first time, which I didn't realize at that point would be the first of many, many trips to the hospital since then. But I actually had a registered nurse who sat down with me, listened to all my symptoms in detail, and said, "You have very textbook occipital neuralgia." And I had never heard of that.
Right.
So yeah, since then it's been a journey to figure out what's been going on and how to treat it.
Yeah. No, so that's to say the least. I think that your story is just so compelling for a lot of reasons. I think number one, it highlights how under-recognized this diagnosis is and how even neurologists, when you don't have classic symptoms, which is another point I would make with your background, occipital neuralgia is off the table. And I think it speaks to the fact that everyone will experience occipital neuralgia slightly differently. And sure, there are classic and very common presentations, but there are also very uncommon presentations that are actually not really that uncommon. And the fact that you would have kind of episodic periods where things were relatively quiescent, and then other times where things were absolutely off the charts horrendous, is probably what confuses people. But again, to your point, it's really amazing that a lot of patients will often come to me and say, I actually sat down with someone, in this case, a nurse, before we even met, who actually listened to what I was going through, and actually, within, a few minutes of actually listening, came up with the correct diagnosis. So, and I think that, that's one of the reasons we do these stories, to kind of educate people about the fact that, a lot of people walk around like you, unfortunately, and they go a long time without even a correct diagnosis or even the possibility that occipital neuralgia could be an issue. And then the other point that I would make is, I think probably one of the things that made your diagnosis a little tricky to figure out is that you had some headache and migraine symptoms probably before you might have had the more classic occipital neuralgia symptoms. And these two do kind of go hand in hand in some cases. And there are a number of people that have both. So most people end up only getting treated for migraines, and that certainly helps some of their symptoms, but not others. Now, ultimately, we determined there were a number of nerves in the back of the head that you needed to have surgery for, which we did about 7 or so months ago. Talk a little bit about the surgical experience. What was it like the first few weeks or months after the operation?
So when I woke up, I was immediately at peace with everything. I figured going into it, whatever happens, happens. I've tried everything at this point, and I think a large part of that was my trust in you too. And you have listened to my concerns from the very beginning and shown more empathy to me than most people have during this whole journey. So I appreciate that. But I ended up waking up And even though I was obviously in pain from having the surgery, because it's a very sensitive part of your body,
Mhm.
I knew something was different immediately. Post-op, I was the day I left the hospital, I don't know if it was just I was feeling great from the anesthesia or what, but I was able to go out and walk, and I was feeling really good, and just trying to like pace myself, but I
Mhm.
felt better than I had felt in most of my life. So I was very shocked to have somewhat immediate results. Obviously, recovery over the next couple of weeks and months was a little bit difficult, but it was truly nothing in comparison to the pain I was feeling before. And I think that made me realize that, I finally had hope for the first time in many, many years, which was wonderful. And I was very lucky to have a good experience post-op. But part of that too is because I've had other surgeries. My body usually doesn't take as long to get back to normal. So I was very lucky in that sense. But overall, I'm very, very happy with the post-op results, and just the recovery in general I was so scared it would be so intense afterwards that I was really pleasantly surprised actually.
Yeah. Okay, good. So yeah, yours is on the, the lighter side in terms of how, quickly and then to what degree people experience relief. And that's always great because that's what we hope for everybody. But cutting to the chase, we are now actually about 7, 8 months almost from your operation. Tell me what life is like now. What's different?
Many, many things. I was not able to consistently exercise before at all. Anything that I did that I overexerted myself would cause a flare up. I'm not in pain every single day anymore, which is so nice. I'm still having occasional flares, but the severity and how long they're lasting is nothing compared to what it was before. And I know this is something you and I had talked about previously, but I'm really only finding that I'm having flare-ups as part of like premenstrual symptoms.
Okay.
So
Yeah.
something that, might just be on the hormonal side. But other than that, I mean, I've pretty much been in the clear. I'm able to do things like travel, not having to worry, which is something I love, and not having to worry about, taking all this medication, or am I going to miss out on these experiences? So it's truly, I don't even think life-changing is like the word for it, because it's so much more than that. So I'm so grateful for the surgery. My only regret in this is I wish I did it sooner, because I've been kind of mulling it over for a couple of years thinking, oh, surgery sounds so scary on the back of your head. When it comes to nerves too, you just never know. But
Right.
I I am so thrilled. Like, I cannot tell you how much it has truly changed my life.
Well, thank you for saying all that. It's obviously so incredible to hear. Um, I don't know if there's much more to say. Really appreciate taking a few minutes out of your day, and so glad that you are doing so well. So grateful for trusting us with your care. Wish you the best of luck. You recently moved to a new city, so have fun. It's a great place to be, and good luck with everything else in your life.
Thank you so much. I appreciate it.
Cheers.
Bye.